Good morning, gang. Dr. Sean here. Thank you so much for joining me in the Winner's Circle. We're continuing our conversation on improving your health. Now, improving your health may sound like a really easy sell. It's something that basically everybody wants, to be healthy. But it's not so easy to operationalize. We're going to spend some time this week talking about some of the perceived challenges, what gets in the way, and then I'm going to make some specific recommendations on what you can do to improve your health. Ready to see what we can learn? Let's get it started. Let's face it, we've all done it. Some of us do it roughly once a year. We make some performance goals, some fitness goals, and then we have difficulty achieving them. Our families want us to be healthier. We want to be healthier. We know what to do. So what's missing? As a physician, when you're asked to see somebody with a familiar name, it makes you wonder if you missed something or if there was something that you could have done. Now we're going to see a patient whom we're asked to clear for bypass surgery. Apparently he has a history of stroke, and so the cardiologists want to get our clearance before they take him to surgery. Okay, so Jim's name was familiar because he was a patient of mine when he had a stroke many years ago at another hospital. Now he has heart disease, another problem involving arteries. Looking at his CAT scan here, since we met several years ago, he's had multiple small strokes that he was unaware of. Well, the good news is that we will be able to clear him for having his coronary artery bypass grafting procedure. The more challenging aspect will be that we still have to get some control of his blood sugars and his blood pressure. Next is routine consult. It's a lady of 77 years who had an episode of weakness on the left side. So Mildred was playing cards with girlfriends when she suddenly started getting numb on the left side. She reports that she felt numbness in her face as well as her arm, and she started dragging her leg. This lasted about 15 minutes. It resolved completely, and so by definition we call it a TIA. Her MRI here shows a lot of small white spots, reflecting that her blood pressure and her blood sugar are probably suboptimally controlled most of the time. The good news here is that we'll be able to tell Mildred that she did not have a stroke. However, the more challenging part will be convincing her that we need to stay on top of her blood pressure and her blood sugars until we get some control here, or else we'll continue to have damage involving the inside of arteries that affect vital organs. If we are able to keep our blood sugars controlled and our blood pressures controlled, then we can mitigate the risks brought on by these chronic health conditions. There are many medical as well as non-medical approaches which can be taken, which can not only minimize the risks of issues that can develop because of blocked arteries, but also increasingly help us find the health that we desire most. Well, as we mentioned before, the hospital is the most appropriate place to go when you have a new health condition, but it's not the place to get healthy. So let's get moving. Congratulations, we've survived another set of health issues, and now it's time to focus on getting healthy. Now, the people that I've seen really focus on getting healthy and set some new health goals, they do well when they make their goals positive. They do well when they think about what they're going to add to their lives as opposed to what they're going to take out of their lives. Many people, they're not aware of this, and then they say, well, I'm not going to get healthy until I stop drinking this, or I stop smoking that, or I stop eating this, or they start thinking in terms of what they're going to lose. But think about what you're going to gain. And so as you set your health goals, set them in terms that are positive. Another recommendation that I'd like to make is this. We should make the goals that we set very tangible. Now, many times we have an idea that we want to get healthier, we want to lose some weight, we want to get stronger, but we need to make those goals tangible. How much weight and by when? What do we want our performance to feel like when we've reached our goals? How is it going to change our lifestyle? Make those goals tangible. Now, in order to make goals that are exciting and something that's worth getting out of bed every day, then we should make them ambitious and fun. It should be something that's going to change our lifestyle. So as we go about setting our new healthy goals, make sure that they're ambitious. And then finally, we should make our goals specific for us. Some goals I had when I was 22, it doesn't make sense for me to pursue them now that I'm not 22. So let's make our goals specific for our specific health condition, for our current circumstance, realistic, make them tangible, achievable, positive, and ambitious, and then we are fully on our ways to do well. Again, this is Dr. Sean. Thank you so much for joining me for the Winner Circle, and until next week,